Hello, everyone. Welcome back to our Thyroid Thursday lives. I am your host, Dr. Anshul Gupta. Welcome to our live sessions. So let's get started. Why don't we get started with some introductions? So I will introduce myself. I am Dr. Anshul Gupta. I'm a functional medicine physician, a formal Cleveland Clinic physician from US, and I've been doing these live sessions to help you out, guys, to take control of your health, mainly your thyroid, inflammation, weight issues, and stuff. So, today we are going to talk about thyroid and weight. A very common problem. A lot of people with thyroid disorders are unable to lose weight. So, that is what we are going to talk about today. Specifically, things that you can do on the daily basis, practical tips, solutions, and then also importantly to know why you are unable to lose weight. So that's what we are going to discuss today. So why don't we start introductions? Please use the chat section to kind of let me know who you are, where you are joining us from, which place, and what are your main problem issues that you're dealing with. Okay, it can be weight, or it can be thyroid, or it can be anything else. So please feel free to put it in the chat section, so I know who you are, where you're coming from. So that helps me a lot to connect with you, because otherwise we don't have other ways to connect, because people are joining us from all over the world. So I would like to know which part of the world you are from, and what are your issues that you're dealing with, so I can help you out better. So yes, I'm going to do a presentation just in a short while, to tell you about the weight issues and how you can help out with it. But yeah, so welcome, Priyanka. Nice to see you again over here. Raji, again, nice to see you from Chennai. People are joining us from Pakistan. Welcome over here. Uh, Suffering from hypothyroidism. Yes, that's what we are going to talk about, hypothyroidism. Mary joining us from San Jose, and then have Hashimoto's disease. Absolutely a major problem that people deal with, Hashimoto's disease. So absolutely welcome, Mary, over here. Sally is joining us from West Africa, Ghana. Welcome over here. Jyoti joining us from India, Karnataka. Welcome. Uh, Lola is joining us from Arizona. Um, you had actually goiter, so you had your thyroid removed, but still having weight issues. Very common problem. And this is time and again, this is what I see, is that a lot of people, who have thyroid issues, they are either told that you once you get on the thyroid medicine, you will be fine, you will lose weight. Actually doesn't happen. Like, at least in my practice, every day I see time and again patients, who have weight issues, even though they have been taking thyroid medicine for a long time. So that's sort of exactly what I'm going to talk about today. Shivani is joining us from Mumbai. Welcome over here. Um, Somebody joining us from Greece has adrenal issues, Hashimoto's, and hypothyroidism. Yes, they are all interconnected. Rajan is joining us from South Africa. Welcome. Anne is joining us from Paris, France. Monica joining us from Romania. Welcome over here. And you have Hashimoto's disease and you're taking the medicine. Clearwater, Florida. Welcome over here. Neelu joining us from New York. Welcome over here. Neelam has a question. Can I see you? Well, yes, we do provide virtual consultations all over the world. We try a level best. So please email us, like go on our website, please email us what are your issues, and my manager can reach you back and see if we can make it happen. So let's see. Anupama has multinodular goiter, a very difficult condition to treat. Actually, a lot of people reach us to for thyroid nodules, thyroid goiters, and some of them get better, some of them don't. Once you reach that stage of goiter, it is very difficult to reverse it. So one of those difficult conditions that I'm still kind of finding ways to. Thyroid nodules, yes, a lot of times we are able to reduce them, but a lot of times they don't even get better. So thyroid nodules, still we have some success. Goiters, very difficult thing to improve on. Okay, so let's see. I think a lot of people have already joined, so I think we will start with our presentation and things. But again, meanwhile, please use this chat section as a way to communicate with each other as well as share your questions. When I'm presenting, sometimes a question pop up in your mind. Just please put it in the chat section because sometimes by the end you might forget it. So please use this chat as an option to share and comment and also ask your questions so that once I'm done with the presentation I can come back and answer your questions, because the real reason of these sessions is actually to educate you and obviously answer your questions as best as I can. So yes, absolutely. So wonderful. So let's get started with my presentation, and then we'll talk more about question and answer after that. Okay, let's see what's going on over here. Let me start with my presentation if I can make it to work. Okay, so this is what we're talking about today. Why thyroid patients can't lose weight even with the diet and exercise. Okay, so these are the stats. Okay, that's what like I wanted to share with you. First of all, 50% of thyroid patients struggle with weight gain issues. Okay, so this is what the research says, at least minimum 50% of people. So if you're thinking you are the only one who are gaining weight or unable to lose weight, then no, that's not true. Around 50% of people are there. And unfortunately, out of those 50% people of thyroid patients, once they go on the thyroid medications and their blood tests are normal, around 50% of around 58% of those people, still are unable to lose weight. Okay, so that's what I was sharing with you, that I have like once a lot of my patients get diagnosed with thyroid disorders after having normal test results for a long time, they think thyroid medicine alone will be able to help them to lose weight. Well, it doesn't happen, and now the research also proves that around 58 to 60% of the people continue to have symptoms, specifically weight gain issues, even though they are taking thyroid medication. So very important to kind of I wanted to you to be aware of this. That's such a big problem. So I just wanted to cut to the chase. Okay, like cut to the chase of like why standard thyroid treatment fails. Because if you have been going through your regular doctors, have been diagnosed with thyroid, hypothyroidism, Hashimoto's, doesn't matter whatever it is, the only treatment they have is levothyroxine, the T4 medicine, right? But does it really work? No. Okay, that's the only medicine they have, and that medicine doesn't do anything for the weight loss issues, right? Because the study clearly shows that 330 people who were on thyroid medications, normal TSH levels, but still they were struggling with weight loss problem. So clearly it is not a thyroid hormone deficiency which is causing this weight problem, right? So it has to be something more. And obviously nobody's looking at that answer right now, because they're very satisfied with their TSH being in the normal range. And if you're unable to lose weight, then basically you just do whatever you can do, because they cannot do anything more for you, right? So that's very important thing to know, is that medications only addresses, can give you some external thyroid hormone, but it doesn't work at the cellular level. Okay, because your cells need thyroid hormone, plus it also needs reduce inflammation, optimize other hormones for the body to lose weight. So this is the underlying problem. Okay, a lot of people think it is about low metabolism, right? Low, like BMR, basic metabolic rate. Well, if the low basic metabolic rate was because of low thyroid, then giving thyroid hormone will fix it. No, the basic metabolic rate doesn't get only fixed by getting thyroid hormone. In fact, the basic metabolic rate is controlled by something else, which is called the mitochondria. Okay, so your mitochondria is a powerhouse of the cell. This is responsible for making energy in the body, right? Now a lot of people uh, think that it is the mitochondria which is being controlled by the thyroid. Well, the new research actually shows It is the mitochondria and thyroid connection with each other which is broken down, which leads to this problem. And giving you a thyroid medicine alone, is not enough to fix the mitochondria. Okay. Now, again, people might have been told you're eating too much. Okay. So go on low calorie diet. Does it work? No, it doesn't work for majority of people. They have been to very low calorie diet. They lose muscle, but they don't lose that belly fat, right? Or you might not be exercising enough, right? People have been to hit like high intensity training. Sometimes that even backfires for people. Okay. And they start gaining more weight instead of losing weight, right? So it is actually this mitochondria that you need to fix, underlying issues, which is going to help you to lose weight, right? Most people think, well, how come mitochondria can be responsible for my weight gain, or fixing the mitochondria will help me to lose the weight. And this is exactly what I'm going to talk about. And this is not just taking a mitochondrial supplement. Okay, so that's not what we're talking about. We are talking about the real problem, why your mitochondria, why this weight gain is happening, and then obviously fixing it. Okay, so that's what we are going to do. So I said, what are mitochondria? Basically, powerhouse of your cell. They are convert your food, right? Because mitochondria utilizes three sources of food. Okay, one, carbohydrates. They burn carbohydrates to again make energy. They burn fatty acids to make energy. They burn amino acids from proteins to make energy, right? So all that food ultimately that you are eating has to be utilized by the mitochondria. And if the mitochondria is not working properly, then obviously that doesn't get utilized. And then what happens is that, that food, or ultimately circulates in your system, and your liver has to pack it into the fat cells. So that's the reason people keep on gaining weight. Okay. So that's very important to know. And then again, research shows very important thing, that thyroid patients has accumulation of dysfunctional mitochondria. Okay, so now each and every cell in your body has mitochondria, right? It is an intracellular organelle. So each and every cell has it. When they actually what they it was an old research study, at that point of time they took, like actually thyroid out once those thyroid patients died, and they sliced them and then looked them under the microscope, and to their surprise they saw huge accumulation of mitochondria which was dysfunctional. That means they were of no use. Okay, and it was not all over the body, it was all concentrated in the thyroid itself. So that again proves that it is basically this dysfunctional mitochondria which is not letting the thyroid to function, and obviously that leads to this huge metabolic disturbance in your body, and then ultimately that's where your body loses gains weight. Okay, so why is your mitochondria getting killed or becoming dysfunctional or not working, right? So inflammatory foods, right? The genetically modified food, gluten, dairy, sugar, all of these are inflammatory foods. Like, so whenever your mitochondria is making energy, right, what it does is that whenever there is a factory, right, which is producing goods, it also produces waste material, right? So if your waste material keeps on accumulating, and if you don't remove that waste material ultimately, then what happens is that that becomes toxic. Same thing happens in mitochondria. There are waste materials called reactive oxygen species, which basically again accumulate in the mitochondria when it is making energy. Now inflammatory foods also causes the mitochondria to make more of these reactive oxygen species. So, more reactive oxygen species means your body is unable to process this high amount of reactive oxygen species, which ultimately leads to inflammation in the body. So that's the reason these inflammatory foods, when I talk about it, like, people say, well, how they're going to cause inflammation? This is a whole process. Okay. So again, that's the reason these inflammatory foods damages the mitochondria and causes inflammation. Chronic stress, right? Chronic stress will cause very high amount of cortisol levels in your body, and that high cortisol level creates insulin resistance and also causes damage to the mitochondria. Okay, it doesn't let the mitochondria to function properly. Okay, the high cortisol levels. Toxins, we have several toxins, which are mitochondrial killers. Okay, so interesting part is that older cases, like cyanide poisoning. Basically, how it poisons, like your body is like basically it just jams up your mitochondria and then suddenly you die. So similarly, these other toxins like heavy metals, lead and mercury, mold toxins, or other environmental toxins enter your body and then specifically targets your mitochondria, and then again damages the mitochondria and makes them dysfunctional. Okay, so the problem is this, this when this damaged mitochondria is present in your cell, it is not working, right? And unfortunately, because it is internally damaged, your body doesn't recognize it, that it needs to be removed. So this dysfunctional mitochondria keeps on circulating or be present in the cell, and it doesn't get removed. And then because it is damaged, it keeps on leaking those reactive oxygen species or inflammation material. So that's a major problem, because now you're dealing with chronic inflammatory condition, right? Because this leaking of inflammatory material over the course of long term basis leads to high amount of inflammation and mitochondrial damage. So again, leaky gut, everybody knows about leaky gut. If not, you should know about leaky gut, because that's again a very major problem which leads to not only gut related problems, but autoimmune diseases like Hashimoto's as well as thyroid problems. So these are the main mitochondrial killers: inflammatory foods, gut dysfunction, toxins, and stress that needs to be taken care of so that we can fix the mitochondria. Okay. So again, why this is the case? Inflammatory foods, like you might have heard me talking before also, because it is completely genetically modified. The body doesn't recognize it because this is the new DNA, and then it leads to autoimmune flare-ups. Okay, and then plus the way we are producing our food currently adds too many chemicals during the processing of the food, right? When we are growing it up, adding different chemicals, insecticide, pesticides, preservatives, and all that stuff, and that again leads to this problem with the inflammatory food, right? Stress and weight gain, we already spoke about. High amounts of cortisol is there, which leads to autoimmune diseases, damages your mitochondria, and then definitely it leads to weight gain, right? Specifically interesting factor is that how to know the stress is causing the problem, right? Is if you have the belly fat, which is in the lower part of your belly and in your hip and thigh region, those are the areas which cortisol will pack fat. Okay, now this stress I'm talking about is not only like emotional stress, but this can be physical stress also, as well as inflammatory stress, because of too much inflammation in the body is stressful physically to your body, right? So that's what the it will typically cause that lower belly fat and the hip area. So if you are that person who has that lower belly fat and doesn't matter what you do, it is not going away, then definitely it is because of high cortisol. Now, as you guys know, you can actually check your cortisol levels through blood work, but they only check it once. So now there is a functional medicine adrenal testing, which is a saliva test. They check your cortisol curve 4 times in the day. So that will give you a complete picture of what is happening with your cortisol. So if you have access to a functional medicine doctor, and if you can get that adrenal test to check how your adrenals are doing, that will be very, very useful for you. Environmental toxins, right? We already spoke about these ones: heavy metals, mold toxins, and other environmental toxins, which leads to destruction of mitochondria and thyroid and all those things. So that's again the way they causes this weight gain problem for you. Okay. Leaky gut, like of or they said gut lining is damaged in the leaky gut, and that helps to increase inflammation in the body, and then ultimately causes metabolic dysfunction, right? And then obviously people also have other issues of brain fog and fatigue and things. Okay, so that's what the issue is there. Now, before we move on to the solution piece of it, a lot of people have this question: how do I know my mitochondria is damaged, right? Is there a particular test? So yes, there is a test which is called oat testing. Okay, so this oat testing is organic acid testing. These organic acids will check for a whole bunch of things, but major role of organic acids is actually to checking how is your mitochondria functioning. Okay, so like if you have this question, well, is my mitochondria working or not? How do I know about it? then you can get the oat or the organic acid testing done. Maybe your local doctor or your conventional doctor might not know about it, but if you have an access to a functional medicine or a naturopath doctor, then definitely he or she can help you to get the organic acid testing done, which will exactly tell you whether your mitochondria is dysfunctional or not. And along with mitochondria, it also gives you some other parameters of your gut health as well as your toxin health. So you will also know why your mitochondria is not functioning. Is it because of toxins? Is it because of your leaky gut? Or sometimes because of deficiency of certain vitamins and minerals, right? Okay, now the solution, right? So the main solution that I always want to focus on is using lifestyle factors as much as possible, right? Because that's the long-term solution. Okay. Now, food, as you know, is the medicine, right? So we want to use food as a medicine as much as possible. So as we discussed, remove the inflammatory foods and add the healing foods. We are going to talk about certain specific foods which are metabolic booster, which is coming up in the next slide. Daily stress management, right? This is the most important thing, and most people miss doing it. Okay. When I tell them to do meditation or deep breathing exercises, nobody wants to do it because it's not fun. Okay. So I understand it, but and then people think, well, how is sitting and doing meditation is going to help me to lose weight? Well, in reality, it does. Okay. Several research studies show that when people cortisol levels improves or comes normal, that helps them to lose weight. Okay. And the easiest way to improve your cortisol levels is obviously doing meditation or deep breathing exercises. Okay. So, and doesn't matter what kind of meditation, right? Like, so again, people say, well, what is the best kind of meditation? Or I don't believe in any religion, or I have certain religious affiliations. So that is fine. Each and every religion across the world has some kind of meditation inbuilt. Okay, so that's fine. You just do whatever you believe into. Do whatever kind of meditation that you like it. It all works. Okay. Smart exercising. Okay. Now over here, hit training has become very popular, but specifically for thyroid Hashimoto's patients, hit training is not a good choice. Because what happened in these high intensity training, you take your body at a very extreme amount of stress, and you demand your body to work at that optimal level, by causing this stress. Now that puts pressure on your thyroid and your mitochondria, so put out that amount of energy. Your thyroid and mitochondria is already dysfunctional, they're already not working. So demanding more from them is not going to be the solution. So that's the reason initial hit training does help people to lose weight, but ultimately they start becoming tired, they becoming fatigued, or they stop losing weight. So hit training is not a good idea for you. That's the reason best thing is a combination of doing a cardio and strength training. That is going to be the most useful exercising if you want to lose weight. And then obviously gut, right? Like everything starts in the gut. Everybody knows these days that gut is where everything starts, so we need to fix the gut. So that's again very important thing, that you need to fix the gut also. Okay, so these are some metabolism boosting foods, okay, that you definitely need to include on the daily basis in your diet, because they are going to help you to lose weight. Okay, leafy greens. Okay, doesn't matter whatever leafy greens you want, whether it's spinach, kale, chard, or any other local greens that you have, but make sure you include them. Protein, as everybody knows these days, is very very important. Okay, if you are vegan or vegetarian, use that kind of protein, like lentils, legumes, chickpeas, beans, nuts, seeds. Great sources of protein. Like if you are eating animal products, then chicken, fish, or organic grass fed beef, or red meat is perfectly fine, right? But do include protein, because protein has amino acids, and these amino acids help your mitochondria to function better. Okay, plus certain amino acids like L-tyrosine and L-glutamine, are really good for your thyroid and your gut and things. Okay, so very important to include complete amino acid proteins. The next thing is green tea. Everybody knows green tea is a metabolism booster. So include them, that will be great. In the morning or in the afternoon you can do that. Cayenne pepper, okay, so that's again like an important process. So obviously a lot of people don't want to eat too spicy food, and the cayenne definitely has a kick to it. But if you can incorporate cayenne pepper, it has what we call as thermogenetic effect. Okay, what is thermogenesis? Thermogenesis is basically helping your body to burn more calories. This food is what increases your basic metabolic rate. Okay, so this is where the basic metabolic rate increases. This is what the cayenne pepper is going to do for you. Okay, so easily, like you can burn 50 more calories just by including cayenne pepper. Okay, so that's, it sounds less, but 50 calories is not a small amount just with one food. The other food that can do the thermogenesis is ginger. Okay, so ginger, again, by different pathway though, it helps in thermogenesis and improves slightly your BMR, but also improves inflammation levels also. So again, include ginger in your regular routine as much as possible. That will again be boosting your metabolism. Okay, selenium rich foods, everybody knows Brazil nuts is great for thyroid health, so make sure you include them. Nuts and seeds, okay, again, very, very important. Over here, don't think that I'm talking about peanuts, okay? So try to stick with almonds, walnuts, pumpkin seeds, sunflower seeds, chia seeds, flax seeds. Those are great options, that is going to help you in boosting your metabolism. So these are the foods, obviously, this is not a complete diet. And that, I've made several other videos of talking about exactly the diet that you need to follow, or anti-inflammatory diets and things. So that's what you need to do. But this is specifically telling you these foods you should definitely include because they are going to boost your metabolism. So GLP-1s, right? That's where everybody's talking about. You might have talked, you might have heard about the Ozempic, Monjaro, a whole bunch of like new GLP-1s combinations which have come out in the market. And then obviously each and every social media platform and different news and different celebrities have used them, and obviously it works, right? People will lose crazy amount of weight, but as any medicine that comes out has a host of side effects or problems. So now we are knowing more and more side effects of GLP-1: nausea, vomiting, gastroparesis. Basically, your stomach shuts down; it doesn't work anymore. And then people, can have thyroid cancers. It does come with a black box warning of that. Thyroid cancer can happen. New, things are going around the internet. People sharing that they might have lost their vision. Obviously, FDA right now has not confirmed that the vision loss is a reported effect, but a couple of people have seen it. So what are the natural GLP-1s? Okay, so that's what we use it. Okay, first of all, what is a GLP-1 molecule, right? What is the role of it? So GLP-1s is a class of molecule which were used in diabetic patients, okay, initially, because they will improve insulin sensitivity and they help people in losing weight. So their diabetes improved significantly, but then realize at lower dosage, GLP-1s can help people to lose weight. Okay. So GLP-1 will make you feel full, okay, because they slows down your gut. So people will feel full longer, so they will eat less. As I said, they also improve insulin sensitivity, plus, they also work on your gut and improves the gut working. So I have identified these four things which work very similarly for all the platforms of GLP-1. Psyllium husk basically promotes fullness. So you will feel full, so you eat less. Okay. Cinnamon improves insulin sensitivity so that your body is sensitive to insulin and doesn't get resistant to it. So you don't accumulate fat. Green tea is a booster of metabolism. Okay. So GLP-1 also boosts your metabolism. Green tea will do that. Turmeric, has shown in research study that it can boost the GLP-1 naturally. Okay, so if you take high amounts of turmeric, that will increase your natural GLP production. So that's what you can do. So this is where I am sharing with you now this daily practical action plan, because that's what I like to kind of share with people so that they can know how to implement it. So first of all, the first thing you do in the morning is that you make this tea that I'm talking about, which is including the green tea, psyllium husk, turmeric, and cinnamon, right? So this is the one that I shared with you over here. How to make it? Basically, you use 1 cup of warm water, and then add green tea into it, and then leave it alone for only 3 to 5 minutes, and remove your green tea bag. Then in that you add half a teaspoon of psyllium husk, a half a teaspoon of turmeric, one-fourth teaspoon of cinnamon powder into it, and then you just kind of mix all of these together, and then you drink it. So this is the first thing you do in the morning, okay? And as you do it first thing in the morning, this is definitely going to kind of jumpstart your metabolism from the morning itself. Okay, so that's what you do. Then obviously, if it is possible for you to do a workout in the morning, go for a brisk walk, 20 25 minutes, or maybe if you can go to a gym, that will be wonderful. Breakfast, very important. A high protein breakfast and low carbohydrate breakfast. Most people are doing it opposite. Okay, what are they doing? They are eating their oatmeals, they are eating their acai bowls, they are eating like bread on toast. Like a lot of Indian families will be eating carbohydrate breakfast like pohas, upmas, and other things, right? So these are all carbohydrates. We don't need carbohydrates, so definitely we need to change our breakfast. So we need to have high protein breakfast and very minimal carbohydrates. So proteins and vegetable is best for you in the morning. So do that. Okay. So that's the breakfast that you do. All right. Then lunch. Okay, so before you have your lunch, have 1 cup of green tea again, or you can do a mixture of ginger tea, and then you can just do that, and then you can also add a little bit of turmeric to it also if you like. Okay, so do this tea again, that will going to keep your body into the fat burning mode. Okay, so before lunch it is also going to improve your digestion also. Okay, so you can do that. And then again, with your lunch you can include some carbohydrates. So lunch, if you want, that should be your the most carbohydrate heavy meal. Okay, so again, definitely include your non-starchy vegetables, your protein, plus you can also include, as I said, some carbohydrates, but mainly what we call as whole foods, whole carbohydrates, complex carbohydrates, which includes your quinoa, your brown rice, or whole grains. So that's what you want to include. So this is your lunch. Now, around, if you have the strength, or if you have the ability of doing this 3 to 4 p.m. workout, that will be awesome, because this is the time where your body's metabolism starts slowing down. Okay, because most of us are tired, we are drained from the energy. But if you have the ability to pack like a small amount of workout, this will be amazing. Okay, for and will be helping you a lot in losing the weight. Again, 20-30 minutes of cardio is great. Again, if you can do some strength training by push-ups, pull-ups, using your body weights, or something like that. Even 10 to 15 minutes of activity around 3 to 4 p.m. would be really good. That definitely will be very, very useful in boosting your metabolism. Dinner, this is the time, basically, again, dinner time, you want to again um, want to eat the least amount of carbohydrates. Again, we are doing it in the wrong fashion. Dinner is the heaviest meal with too many carbohydrates, and that again slows down our metabolism, doesn't let us to lose weight. Okay, so try to avoid carbs, stick with more with vegetables and protein with your dinner. Okay, and then preparing for the night. Now, most people are thinking, actually what is happening is that it's during the day, or morning is a time where we lose weight. Well, everybody is doing their morning right, but nobody is doing their night right. And that's the reason we accumulate fat mainly in the night, because our liver, our body starts taking what we have consumed during the day, and then we pack it either into the fat cells or not. So if we do not support our liver, or we do not support our metabolism in the night, then all that carbohydrates, all that excessive calories are going to convert to fat. So this is where this nighttime drink is great for you, where I include coriander seeds, okay, and fenugreek seeds. Okay, both are really good, because they both help in, again, insulin sensitivity, and also help your liver to function better. Coriander seeds are awesome. They help in detoxification, supporting your liver health. Fenugreek seeds, again, are great. It improves insulin sensitivity. and then cinnamon and ginger, we already spoke about it. Okay. So basically, again, how you do it, you have to soak your coriander and fenugreek seeds. So 1 hour before, like take warm water, soak your coriander seeds and fenugreek seeds. You can just do half a teaspoon of each, and then you can just filter out the water 1 hour later on. And then later on you can add some cinnamon powder, like 1/4 teaspoon, and then grate some fresh ginger into it. And then you can drink this tea around bedtime, like half an hour before your bedtime. Okay. Now this will be awesome, because what it'll do is that it will keep you into the fat burning mode in the night also. Okay. So that's what I wanted to share with you, kind of a complete routine that you can utilize specifically from the diet perspective. So start your morning with this particular drink, which is going to boost your GLP-1, high protein breakfast. Lunch should be your most carbohydrate heavy meal. Excuse me, guys. Lunch should be your most carbohydrate heavy meal, and then pack another round of exercise in the afternoon if you can. And then dinner, the least amount of carbohydrates, and bedtime tea. Okay. To boost your metabolism. Now, supplements that can be useful for you: obviously selenium, zinc, L-tyrosine are very important to boost your thyroid functioning. So if you do have a thyroid disorder, you need these three supplements, otherwise your thyroid is not going to work. As you know, we have created a thyroid balance supplement which has all of these three things plus couple of other nutrients for your thyroid support. The link will be in the description if you want to buy it. This thyroid balance or thyroid support supplement is great. Then you need curcumin, ginger, boswellia for reducing inflammation. Again, through Inflammapro, we have combined all of these, which is going to reduce inflammation, boost your body's functioning. Magnesium supports your mitochondria. So again, a great supplement to work on it. And then some specific mitochondrial supplement. But don't start with the mitochondrial supplement. Start with these basic supplements that you definitely need. And then after 3 to 4 weeks, if you're still kind of not getting the result that you want, then add the mitochondrial supplement of acetyl L-carnitine or coenzyme Q10. That will support your mitochondria. Okay. So basically, if you follow that daily routine plus combine it with these supplements, then generally people will see this thing, in initial 1 to 2 weeks you will feel less bloating, you will feel improved sleep. By 3 to 4 weeks you will feel that your cravings for sweet or food is decreasing, so you have more control on what you're eating. And then definitely by week to 5 to 8, you will see a visible weight loss. And visible weight loss is like what I'm concerned about, losing the visceral fat, okay, which is around your belly area, because research says that it is that visceral fat which is responsible for causing major health related problems. Okay. So what people will typically report back after following our protocol is that, well, I think like my clothes are fitting better to me. Well, my friends have been kind of saying that my body shape has improved, or like I feel in general that my body, I have lost some weight around my belly area. Okay. So that's what you're looking at. Don't keep on looking at the needle of the weight machines, but see how your weight around your waistline or your hip and your thigh area is getting better. So that's what the goal is. Okay. So again, it is not going to have it, like you're not going to achieve it in a day or two, 1 or 2. So it is a commitment, and there is nothing better than that. Even with Ozempic, you're not going to lose weight in a day. It takes around 5 to 6 weeks. So like this is the natural Ozempic protocol that I shared with you, that if you do it, you will start losing weight, and see similar results. So this is the advanced thyroid bundle, as we have it, which has a thyroid balance, which all the thyroid related things, Inflammapro, Omega, and the magnesium and probiotics. Very nice bundle, I will say. If you have thyroid or Hashimoto's or hypothyroidism, then you should definitely include this along with the lifestyle choices. So that's what I wanted to share with you, an actionable plan that you can take and do. So hopefully this was useful for you. Now obviously we'll open up for questions. So any particular questions you have about today's presentation or anything related to thyroid or inflammation or weight, you can put it in the chat section so I can answer those questions for you. Okay. All right, so let me stop my presentation so that way we can take some questions. Okay. Is there any special test for mitochondria? I hope you know now you know the answer to that question. That yes, there is organic acid testing, which will tell you about the mitochondrial health. So I think definitely will recommend you to get that testing done. Okay, let's see. Mold toxins come through food or the air we breathe? Very good question. Like if you will Google it up, like they will say, well, the mold toxins are coming from your food or coffee and things. Well, that exposure is very small. Okay, that typically will not cause too much of a problem. That the most common exposure which we know through research studies which causes health related problems is the air we breathe, which is when there is water damage to the house, or if you're going to a hotel which had mold into it, or airbnbs or extended vacation houses, all of those places, or work related like exposure, these will be the buildings that mold might have crept it into your system, specifically mold toxins. Okay, so, and then as you know, there is a test to check for mycotoxins or mold toxins. So, you know exactly if the mold toxins are present inside your body. This test is very different from the mold allergy test. A lot of people will go to the doctors, and because most doctors are not well versed, even a lot of functional doctors are not aware of the mold toxin test, and they will do a mold allergy test. Oh, yes, you are allergic to mold. No, this is not what you're talking about. We are talking about specific mold toxins, mycotoxins, which are living in your body right now. We want to know whether that is the case or not. So there is a specific mycotoxin test for that. So that's the case. So let's see. Well, cayenne pepper is a nightshade. Well, if you keep avoiding foods, then literally you will have no food to eat, because there are nightshades, then there is high oxalate food, then there are kind of anti-inflammatory foods, then there is a paleo diet, then there is a carnivore diet, right? So, the list keeps on going on and on, right? So, you cannot have like, everything that you want to do. So it depends on what you want to achieve. If, like there is no research, absolutely nowhere published at all, that nightshades are bad for thyroid patients. Okay, absolutely, look at the research and there is none. It's not, I'm not saying you should eat nightshade, I'm just sharing that experience and things. But yes, it's totally up to you. Avoid the night, avoid the cayenne pepper. If you don't want to, like, eat the other foods then. Okay, so that's great. So let's see. And how can we get your recipe of the yerba mate and the other things? Just watch that video if you have seen that video over there. That will help you to get that recipe of all of these things. Which yerba mate is a great option instead of green tea. As you know, I've compared the green tea and turmeric tea with yerba mate in the morning, and it was amazing that how yerba mate actually came out better than that. So yes, please watch that video. I exactly share the recipe over there with you guys. What type of carbohydrates? Millets or brown rice? Both are great. Brown rice is my option to do, but millets are equally great. Okay, so you can definitely do that also. Is coffee okay to drink daily for Hashimoto's? Well, it depends. And we do like to do a caffeine-free month. For some people, caffeine is a problem for Hashimoto's, and it can be a trigger. Okay, so but most of the time, 1 cup of black coffee is most time okay. But if your antibodies of Hashimoto's is not getting better and you've done everything else, then I will say try to give up coffee for 3 to 4 weeks and see if your Hashimoto's antibodies gets better. If they do, then you have your answer. But otherwise, you can drink it. Okay, Rahul has a question. I have ankylosing spondylitis. I am taking these immunomodulator medications, help to reduce inflammation. Well, follow the anti-inflammatory diet that we have shared, plus using the Inflamma Pro supplement as well as using the Omega supplement combined with vitamin D is great. So those are the places that you can start off with. What should we do if you want to stop taking our medicine daily in the morning? Well, that's a difficult question. You have to work with a functional medicine provider with the hope that he or she can look at your case and see if maybe, you can stop the medicine. So you can do that. How can you buy this supplement from India? So we have a supplement store in India also. So you can just go to this supplement store, and there will be a link on top of it which says, if you want to shop in India, so you click over there and you will be able to open up our supplement store in which is present in India. Okay, so that's great. Supplements I have purchased should be taken once a day. Well, I don't know which supplements you have purchased, but on our website, if you have purchased our supplements, our website with each and every supplement, it will tell you there is a tab over there how to take them, okay, and how much to take them, okay. Which protein for Hashimoto's? Whey or whey isolate? None. Vegan protein. Okay. So vegan protein is the best, and then collagen peptides the second best, and then go with vegan protein because whey has it is very processed, so it causes most of my Hashimoto's clients, they do not tolerate, or ultimately it causes their antibodies to go high. So that's what so that's the case. So let me take a few more questions, guys. um, Somebody has this question, I have hypothyroidism and hair regrowth is possible with minoxidil. You can try it. Works sometimes, majority time it doesn't work. And hair fall or hair thinning is a major problem, and it is not easy to control it. I have made a couple of videos, so you can try those recipes and things. But yes, it takes a lot of effort. Different kinds of supplements, like sometimes the peptides are very useful in that, for hair problems. Okay. Uh, Read that polyunsaturated fats block thyroid hormone pathways. Is it true or not? Well, it depends on where you are getting those polyunsaturated fats and what kind of polyunsaturated fats, right? Because there are all different kinds of polyunsaturated fats, right? So that's what we have to look into those and see the source of them, because fat itself is a very big category. We have saturated fats, unsaturated fats, polyunsaturated fats, and then monounsaturated fats and things. So specifically which fats are we talking about, that's where it depends. And then we make a case of, okay, well, which one is good and which one is bad. Okay. Let's see. I'm addicted to dairy. Will dairy cause inflammation? Yes, dairy does cause inflammation, so I definitely recommend people to give up dairy. So that's great, guys. Thank you so much again for joining us. I think this is what I have today. I hope it was useful. Please sharing your love. Please hit the heart icon. And then again, so that we know that it was really useful for you. Please keep on being active in the community section so that you will know exactly what all things we are coming up with. Soon I am going to be actually doing a thyroid summit, which is coming up in next few months. So look out for that. It will be a mega event of 5 days, where it's completely online, where we will be having 30 plus speakers talking about thyroid, Hashimoto's, inflammation, whatnot, free to attend. So that's what is coming up in the pipeline. So I'm working on that. So keep out with in the community section where we are going to share all of this information with you, and keep seeing you here as always. It is always nice to see you again. Please keep sharing your love, and also keep sharing the videos and what we are sharing with you, the information, because sharing is caring, and that's what I'm doing. Whatever I have, I'm sharing with you. If you feel it is useful, please share it with others. All right, guys, till the time, thank you so much. Again, pleasure joining with you today, and take care. Okay. Bye bye.